the next person I'd like to invite up is Professor Pat Duggan. And Professor Pat is a Bardi woman from the Kimberley area of West Australia. She's a psychologist and a fellow of the Australian Psychological Society. She's a professor and Poche Research Fellow at the School of Indigenous Studies at the Uni of WA in Perth. Her area of research includes Indigenous social and emotional wellbeing and suicide prevention. And amongst her many commitments, she's been a former commissioner with the Australian National Mental Health Commission for 5 years, concluding in 2017, Deputy Chair of the Australian Indigenous Psychologists Association, Chair of the National Aboriginal Torres Strait Islander Mental Health Leaders Group, Co-Chair of the Ministerial Advisory Group on Mental Health and Suicide Prevention, and she's a member of the NHMRC Mental Health Research Advisory Group. Goes on, worse than me. No, she's a director of the Aboriginal Torres Strait Islander Suicide Prevention Evaluation Project, which has been done a couple of years back, but she's currently the head of the Centre for Best Practice in Aboriginal Torres Strait Islander Suicide Prevention at UWA, on quite a number of other research projects, does a lot of clinical and cultural capability modelling in mental health, and really has been one of our very strong leaders in mental health and suicide prevention over decades now, since she first graduated as a young girl. It's our first Indigenous psychologist.
That's right.
Yeah, way back then.
Yeah,
So,
back
Professor Duggan.
Thank you, Tom. It's a hard time to have a forum, everyone, but because it's after lunch, and if you're like me, you've pigged out on all those sandwiches and now you feel like a nanny nap. However, before I start, I'd like to acknowledge Ngunnawal country, elders past and present. I'd like to acknowledge the Poche family who have made this possible for us to come together and certainly have provided springboards for our work to happen. I'd like to acknowledge everyone in the room. My presentation today, it's sort of about the workforce, but I wanted to share some of the work we've been doing and probably allude to what role does a workforce play in that. So I wanted to talk a bit about Aboriginal Torres Strait Islander mental health and suicide prevention, which is my expertise. So I'm acknowledging country, but most of you know this. I always do this as a matter of course, that Australia has a population of 24.13 million people. Only 3% of that is Aboriginal Torres Strait Islander people. But despite our very low numbers, we've got very high statistics in all the bad social indicators, social and health indicators, like for instance the life expectancy of Indigenous people is around 10 years lower than that for other Australians, and that's probably a conservative estimate too. Indigenous infant death rates remains at 2 to 3 times the non-Indigenous rates. Homicide death rates are 6 times higher. There's very high rates of arrest and imprisonment. Sometimes our people make up 90% of the people in a police station. So on all other social indicators such as average income, home ownership, employment, education, we do very badly. Particularly in suicide, that's become a really big issue, and as we saw from the launches that most of us attended this morning, it's become a headline issue, and rightly so for Australian the political area to deal with, and big changes needed. As you can see, when I think looking at charts are good, but we need to remember that behind all these statistics are real people, whether they're Aboriginal or non-Aboriginal. So we've got to just remember that. But when you do the comparison and look at it proportionately, you can see that Indigenous people are very much overrepresented in suicide rates. This is not just about us, it is a global story. Last year we had the second World Indigenous Suicide Prevention Conference in Perth, and I don't know if you can see that on the screen. For me it's very tiny writing, but in any case you can Google our website and get these get the paper that we wrote, Global Suicide Statistics. But we're not the highest rates by far. On average, Indigenous suicide rates in settler countries are twice that of the rest of the population. So there's something happening. It is our high suicide rates and other disadvantage is directly related to colonisation and disadvantage and all the things that have happened to us. We started working in the area. We were commissioned by the government of the time. That bell's terrible and distracting, as it should be, I suppose. It has to distract people. Anyway, we were commissioned by the Prime Minister and Department of Prime Minister and Cabinet because they weren't sure on how to fund Indigenous suicide prevention. And I know it sounds ridiculous now because we know so much, but at the time they weren't sure about how to go about addressing suicide prevention. You had all these big suicide numbers happening with very young people in our communities as well. So they commissioned us to find out what works in suicide prevention and what they should fund. So after 2.5 years of work, we came up with solutions that work, what the evidence and the people, our people tell us. And that was a big suicide prevention evaluation project. We based it on a previous suicide prevention plan that had been in place for Indigenous people, but it was about building strength and capacity in Aboriginal Torres Strait Islander communities. So effective suicide prevention had those elements. Effective suicide prevention built strength and resilience in individuals and families, but there also needed to be targeted suicide prevention services, so special services for youth or LGBTIQ and so on. There needed to be coordination of approaches to prevention, so it's never going to be just one program. It's how lots of different programs and services and how these interact together. It also needed good suicide prevention, need to build the evidence, be built on the evidence base, and it also need to disseminate information. So we knew there were some good programs out there, but they didn't get heard, they didn't get a voice, so they weren't shared. So there also needed to be standards and quality in suicide prevention. So, I'm proud to say, because we went and did this big mega evaluation and literature review and everything else, and then we thought, no, we've got to go talk to the community. So off we went and had lots of round tables, even though we were a bit apprehensive, because one of the things our people say is, we've been researched to death and nothing ever changes. But we were compelled. We wanted to do it participatory action research style. So we had a number of round tables and the first national conference to talk about what needed to happen as well. And then we developed solutions that work, and we launched it here in Parliament House in 2016. And we were thinking, oh, gosh, what if this becomes just one of those other reports that get us dust? And there's lots of them on Indigenous issues, and they sit there gathering dust and they're never implemented. And, occasionally someone will pull them out and give them a ring around the place, ding, 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 like this, but nothing happens. But I'm really pleased to stand here and tell everyone that Solutions at Work has become the blueprint for Indigenous suicide prevention. And some people say it's the Bible, and we really like them. And then some people say, oh, it's a bunch of rubbish, we can do better. And I like that too, because if we can improve, that's really good. And it has to be Aboriginal-led. After ATSIPAP, and you can download, if you go to our big promo, everything I'm talking about is on our website, so please avail yourself to those resources. After the ATSIPAP report, we tendered, and we were fortunate under the Poche Centre to get the Centre for Best Practice in Aboriginal Torres Strait Islander suicide prevention. We're about two and a bit years into our operations, but basically it was to continue some very good policies before us, such as our national plan, which is being renewed, It's also to look at those things that we spoke about in ATSIPAP. What are the good programs? What are the principles around good programs? And where do they get promoted? So some of our job, and we've started, is putting up best practice programs and services, best practice national and international research. And our most important job is to work with the PHN. So we're doing a round of national round tables. We're also got staff employed who directly talk and negotiate with the PHNs, because they're actually the funders of suicide prevention in our community. So it's very important that we do that. And all these things, it's like playing lots of, I don't know, musical instruments at once, if you like. So we've got a lot ahead of us, but it needs to be done, and we won't be, you know, we look for collaboration where possible. But it's important that we promote and disseminate best practice for all stakeholders and the academic community too. You know, we get exhausted by doing grey literature, so we need to put more of our information into refereed journal articles and get it out there as well. We need to be, we and all of us, whether it's on suicide prevention or other research topics, need to start engaging and sharing our knowledge and the outcomes of our research. Part of our responsibility was to do the 3rd National and World Indigenous Suicide Prevention Conference, which we have done, and we're continuing to work with PHNs to develop a manual on how they can do co-design with our communities. Some of you were at the launch today, so I will be repeating myself a tad. The big outcomes out of the National and World Indigenous Suicide Prevention Conferences, and they were important because we got 550 people plus to Perth for this conference, and that was very important for us. But some of the big outcomes, and we were getting recommendations throughout the 4 days of the conference and feeding them back to participants. Anyone could put anything on butcher's paper around the wall, and actually I'll just mention Dawn Bessarab, who was the co-chair of the conference. So she was the co-chair with Glenn Pearson of our conference committee, and Tom was our conference patron. But basically it was a rip-roaring successful conference, both the national and the world part of it. But what we gleaned and analysed from all the input that we were seeking is that conference participants want recognition of the history of colonisation. So that's important in suicide prevention, because that has shaped what we are now. And governments need to acknowledge this too. So that was an important thing. As we found in the ATSIPAP work that we had done, self-determination is very important at all different levels. We actually developed an Indigenous governance document, and that's part of the 5th mental health plan. But what we looked at is how do we get people, and I'll just get this chart up because I wanted to mention some other things before I finish, but how do we get communities and government and funders to work together in ways that are empowering and involve co-design. So we've been going around doing a bunch of national conferences. IHA's work's very important too in what we do. We're talking about cultural competence and increasing the Indigenous workforce, etc., etc. There's a lot of different strategies that need to be put in place. But I can say that, you know, all our national big round tables that we have, and we get up to, our ceiling is 60. They're never empty. They're always full, and we're, you know, to capacity. And these are with senior decision makers, and they want a change. So I look back, you know, in brackets of time to when you only wore the Aboriginal flag or flew it if you were being, you know, that was fighting words if you wore a T-shirt with a flag on it, with an Aboriginal flag on your T-shirt. And now to see the flag so well accepted, and us to be having talks about reconciliation and racism and a lot of things that were denied. So I think that there's been a huge progress, and even in the time 2016 when we started ATSIPAP to now, just the dialogue and commitment to suicide prevention has been amazing and progressive. So earlier this morning, we launched the Guy Dewey Proud Spirit organisation, and also our own Aboriginal Torres Strait Islander lived experience network. And I said I applauded the government for doing those things. 2 years ago, it would have been out of the square to even consider. But, okay, and you might be thinking, it's after lunch and I feel sleepy, and what's this got to do with workforce? Well, lots, actually. I will answer your question, lots. Because I think that in all of this, there's a role for all the workforce, and we actually, in all our busyness, we won a Million Minds mission research grant, and IHAR is one of the players in that, and it's all about access. Our whole grant pivots about increasing the access for Aboriginal people to mental health services, to workforce, etc., etc. So it's for 5 years, and we just got under $5 million, so that should give us a good run-up to do some good research in the area. It's very broad though, and I go look at it and go, oh my God. But one of the issues we will explore is workforce and how that fits together. This might be, and I know there's talks, a lot of the Poche centres are involved in the research grant, and it might be increasing the number of Indigenous psychologists, Indigenous social workers, and so on. But it's also about looking at the vet sector too, to see how we can train community people to upskill so we can capacity build but keep them valued in their communities. A couple of months ago, Minister Ken White made this announcement, and he said that what would happen is for critical response, because that's important, and we have colleagues who run big critical response services. He said that he would expect community people to become critical response officers. And there was a bit of a hoo-ha about that, but I think what people fail to see is that if those people are trained well, paid well and kept in their community, they're a valuable resource. So I think that our workforce for suicide prevention, for mental health, is extremely broad. And I think the speaker before me might be focusing into some of it, but it is a dialogue that will be ongoing. So on that note, I'm going to cunningly not answer the question totally, but say that we'll be working on it, and really it's got to be everything. It's got to be holistic, and it can't just be in universities. It has to be training in communities, the TAFE sector, and so on. And on that note, I shall say thank you, Tom.
No. Come on. No, you haven't.
Oh, well, that's good.
You've got plenty of time there.
Skipping those PowerPoints.
No, you've got plenty of time. Well, thank you, Pat. One of the things that Minister Wyatt did say, though, when he talked about critical response respondents, was that it was for people on CDP. And so the unemployed people who would be trained up and skilled up on mental health. So it's a matter of I guess working with him to come up with some solution so they can, if they had the capacity to progress onto employed positions. But it is a start.
And could they get a loading as well?
Yeah. And so that's a bit of a challenge. You do a bit of training over there in UWA in workforce, mainly at the university level. Did you want to explain? Yeah.
Look, we've got, and I'll actually throw it over to the director of that particular part, obviously being Professor Dawn Bessarab. I think I neglected to say when I was painting the grim picture of Indigenous disadvantage, which is real and it's there, one of our success stories actually is in higher education. So, our first ever identified Aboriginal graduate was in 1966. That was Charles Perkins. When I was going through school, and I had a graduate diploma at one stage there, I was like one of the highest educated Aboriginal people in Australia. Now we've got PhD degrees, big centres in each university. It'd be very unusual not to have one. And that's been beneficial not just for us, but for mainstream too, because we're bringing an Indigenous perspective there. But there's also specialty programs, and medicine's been a very one that's had the focus. And so, Dawn, do you want to say something about Camden? Throw that microphone to Dawn. I feel like I'm trying to say poorly what you can probably say a bit more precisely in that you're in charge of.
Well, thanks, Pat, for putting me on the spot. So the Centre for Aboriginal Medical and Dental Health, Camden, was started back in 1992, I think, and Helen Milroy was a part of that journey, along with non-Indigenous doctors, Dr. David Atkinson, and then followed up by David Paul. Since then, we've had about 46 graduates of Indigenous doctors in Western Australia, so we're building a critical mass of Aboriginal doctors, and I know that there are Aboriginal centres in other parts of Australia too. In relation to Camden, we provide 2 alternate pathways for Aboriginal people into medicine at UWA. One is through the School of Indigenous Studies and through the direct entry pathway. So young people aspiring to do medicine can enrol through UWA in the direct entry, which means that they do their undergraduate degree, and then they have an interview with us at Camden, and then they go into first year medicine if they so wish. Or they can apply to enter medicine by having an interview with Camden. We're currently, we've got an aspirational target within the university, within the medical faculty, of 10% for students, so that approximately is around 15 students. We've not actually met that aspirational number, but this year we've got 8 people who are our biggest number of applicants. We get people applying from across Australia. We don't, our students applying to do medicine don't have to sit the GAMSAT, or now they've changed it to the UMAT across Australia, but they do have to have an interview. So we interview them. We've introduced a small test around maths and science, because UWA course is now a postgraduate course. It used to be an undergrad, now it's a postgrad. So we encourage Aboriginal people to apply to do medicine, and last year we had a very successful graduation of 3 Indigenous female doctors. One was from a regional area, she was my niece from Port Hedland. So it's really exciting to see community people coming in and doing medicine and graduating as doctors to go back to their community, as well as young people within the urban area. We don't just graduate them as doctors, we graduate them as dentists. So this year, I think in the program we've got 2 or 3 people doing dentistry, which is excellent. But we're trying to encourage them to go into specialisation such as paediatrics and any other area that they might want to specialise in. So yeah, and I think one of the things that I'm interested in is how we can support Aboriginal people who may not have a undergraduate degree but come in through a certificate program, and that's something that we're still playing with and looking at, because to make the step from being a community person to a certificate into university study, that's why I really think it's great what I've got the acronym. Yeah, IHA. It is a really big step for people to step from the community into a university program, because it's a whole different ball game, and they do need a lot of support around that. So we're still looking at that. UWA medical program is a really fast program. You've got to hit the ground running. So we don't want to set our people up to fail, even the postgrads. Yeah. So I don't know if that's what you wanted me to talk about, Pat.
Oh, and well said. Thank you.
You also, a couple of years ago, the Dux of Medicine was an Aboriginal person? Yeah.
Yes.
Yeah. Yep, mainstream, yep, so it was good. And I think the Indigenous doctor you mentioned last year was a Poche, received Poche support in coming through Venka, was it? And went through? Yeah. Venka. Well, year 4, yeah. Okay, thanks.
There's one question.
Oh, we've got a question, excellent.
Hey, I'm Tom from Senator Rachel Seaworth's office, and I just wanted to ask some questions about policy measures we can take to improve Indigenous Australian mental health outcomes. Specifically, you mentioned that at the 2018 National and International Suicide Prevention Conference that was held in Perth, that one of the main recommendations of that conference was to ensure self-determination for Indigenous people. And I was just wondering, with the cashless debit card trials that are currently being rolled out across the country, specifically the most recent one being in Seduna, we've heard anecdotally about the massive psychological issues that may create for Indigenous people who are on welfare. So I was wondering what your specific opinions were on the cashless debit card trial system.
Okay, well, that's an interesting question. I'll think about it and get back to you. No, look, I think that you can't except give a personal opinion on it. So I'm going to give my personal opinion. I think if a community requests, the council or whoever's got authority or governance of the community requests that if they feel that their members need a bit of extra support, I think then it's okay. But if it's imposed, I have a problem, even if it does fix things up, because I think that takes away people's free will and ability to make decisions. And I know that's, probably not considering all the intricacies, and, but I think that, we have come out of a whole process where our free will was taken away. We were decimated. We were hunted out of our home countries. We were put into missions and reserves. So this is a little bit that element again. But at the same time, I acknowledge that I sit, in a university too. So I think it's what the community would say would guide what I'd do.
And if I could just ask about one more policy measure quickly, if that's okay. Monash just recently, actually this morning, released a report that looked at the link between mental health outcomes and welfare rates, and specifically in terms of the New Start allowance. So the New Start allowance obviously is currently set incredibly low. It hasn't been increased since 1997. And that Monash study found that 50% of the people on New Start report as having mental health issues. And I was wondering whether you thought that increasing the New Start outcome, which is something Rachel is currently quite interested in, would potentially increase or better Indigenous Australian mental health outcomes.
Oh, look, I think that from what I've heard and people trying to live on New Start is that it's pretty dismal, and if we had a referendum, I'd vote to increase it. I like my taxpayers' money going on to stuff like that. I think that's important that we keep a civil society and we support our people who are disadvantaged, black or white. So I think that that's going to have, who wants to live in poverty? I mean, and with poverty it becomes, your life is very restrictive. And, we've been there, all of us students or whatever, where you're worrying about how you're going to pay your next electricity bill. And, I've been reading stories about people losing their shelter, being evicted and whatnot. So I'm afraid that I think New Start should be increased, and I think that the draconian methods that they use are not useful or humane. So, sorry, again, I've got a political position on it. I don't support it. I think ultimately it'll lead to bad mental health outcomes. I think people will lose their self-esteem, their sense of dignity as human beings, and we don't have to rub their face in their poverty. Find them jobs and support them properly, I say. So sorry, a passionate and very subjective response, but I don't think you could do otherwise. Well, I can't anyway.
Yeah. As part of the empowerment project.
Yeah, we're into that.
Yeah, do you want to talk about that?
So Pat, I'm Lenny, I'm from Geraldton. We have a big increase of drugs taken over our young men, mental health, suicides. I'm a survivor of my son trying to take his life 5 times last year. So I think we would be the best mentors to be able to help other people. I've had a 12-year-old niece taken her life last year. So I think maybe look at people that have got that lived experience that want to help other people in the community, because as you said, we're the most over-researched people. We're sitting around a table talking about all of this. Maybe talk to the families that have been affected by that and see if they want to give back to the communities to help other people, because I don't want to see my sisters or my aunties do what I've been going through in the last 12 months.
Absolutely, and thank you for your comment, and that, thank you. Thank you. And we're hoping that Leilani's, the project that was launched this morning under Black Dog, the Lived Experience Centre and Network, will bring together people with lived experience, not only so they can heal and support each other, but so they can have a voice and an opinion. They know best. I mean, we are a bit distanced from it, so we need to get our mob with lived experience, LGBTIQ, SB, people who, youth are another important group of people, so they need to speak for themselves, and that's what we're about.
Thank you. Any other questions or comments? I was going to ask, Nicole, about the empowerment project. Was there anything that, can you remember back there that, you know, people talked about that whole issue of, you know, developing resilience through you know, being supported? And it's like, you know, people are, you know, if they can have hope, if they can feel that they're valued.
Bit of agency. I think we did this big program, which is still happening in Perth, and you know, one day it might be funded in other places, but it was about basically from a cultural lens, providing opportunities for community grassroots people to learn to facilitate their own empowerment. So it was about having a bit of control over your own life, being able to manage thoughts and just, you know, what others might think were basic, and I'm not doing it any justice because I'm trying to rush it through now, but it took us a long time to develop it, and one of our sites was funded while we were still developing, which was good for us because we were able to pilot it as we were developing it. But that was a good program. It was expensive because it was based in the community and it was run by community people who we train. It is still happening in Perth. It's not anything, it doesn't have any magic answers. It's basically about increasing people's self-awareness in a culturally appropriate way and valuing Indigenous culture and giving people some confidence. So it had some big outcomes. A lot of the people who were doing the program got jobs. They felt that they could parent better and do a whole range of other activities. So it was a life changer for many people. So we'll be evaluating the Perth program again to see if we can find more information about that. But that's certainly one of the examples of what we would call best practice, because it's owned by the community, delivered by the community, and it's community choice.
Nicole, no, you're right.
Yeah.
Okay, well, do you want to introduce your video?
Oh, okay. This is the second time I'm doing it. I introduced it this morning and then it didn't work. From the conference, it was important that we had all those different people there from the different groups, youth, LGBTIQ, elders and so on. So within our vulnerable groups, there are other vulnerable groups. But one of the things the youth came up with is they developed this video. I mean, obviously adults help, but they led it. And the video is called Love and Hope, and it is about, you know, acknowledging suicide and what needs to be done in suicide from a youth perspective and from things that happened, activities that happened at our conference.
Thank you. And so it only goes for 3 minutes. Then if you can break for afternoon tea, and we'll resume at 2 o'clock. So hopefully it works.
Mandra.
We can get it.
Rivers flow it's taking me back home. For as long as you feel love, for as long as you feel loved, the song is first raised, birds awake on, brings a fresh new day.
I sit in the night, the stars are bright, through the branches of the julga tree.
For as long as you feel loved, for as long as you feel loved.
Yeah. As long as you're feeling love, that's all that matters in the end of the day. I see so many people trying to fit in, but be yourself is the way. Never care what they say, stay on your grind, and everything will be okay. Shoot for the stars, forget all your troubles in the day. Keep your head full of hope and your heart full of love. Remember where you came from and who you are. Culture is everything, and culture is life. So when I'm rapping on the mic, I bring my culture to life. We all destined to rise, we weren't born to fall. So if you see a brother and sister down in the dumps, give a helping hand up and ask if they're okay. Cause no family should have to bury their loved ones on any given day.